So we'll work around that rather than fixing the problem.
Thank you. I call the Honourable Member Melissa Lee.
Thank you, Mr. Speaker, and annyeonghaseyo. So it's a great pleasure to rise to speak on the first reading of the Vulnerable Children's Bill, and the whole aim of the bill is to protect and improve the well-being of vulnerable children here in New Zealand, especially in the area of reducing the number of assaults on our children. Too many of our children in New Zealand are seriously abused and neglected, and many cases of extreme abuse. Many people had a range of knowledge, some knowledge, but no one in particular had the whole piece together, and hence the help actually was not available. This national-led government is taking action to protect our children. New Zealanders asked us to do that, and we are taking action, and we are delivering on that promise. And I'd like to take this opportunity to congratulate the Minister, who has done a great deal of work through the Green Paper consultation as well as the White Paper consultation right throughout New Zealand, where I have actually witnessed her speaking in many, many public events. And I congratulate her on the development of this bill and bring it to the House. And I will welcome the submissions from the public and look forward to the robust debate that will actually happen in the Select Committee. And sitting here listening to the members right across the House and seeing their passion, we are all focused on our children, and that is actually I'm very glad to see that. I was sitting here looking at the plaques on our wall and remembering that, our forebears fought for this country to make sure that New Zealand is left in a better condition, in better hands, better developed for the future of our children. And to see that more than 50 children have died in the last 5 years in this country, and the Minister of Justice actually quoted this, and two is hospitalized every 5 days. I sort of wonder what our forebears will actually sort of think where New Zealand is right now in terms of the way we treat our children. They are the most vulnerable, and yet there are people in this country who maim, who kill, who hurt innocent children, who cannot even respond to that kind of abuse, and they cannot even say who hurt them. This bill will result in 2 new acts, the Vulnerable Children Act and the Child Harm Prevention Orders Act, and it also amends the Children and Young Persons and Their Families Act of 1989 and the Kiwi Saver Act of 2006. So this bill is about reinforcing the need for shared responsibility and coordinated and collaborative action across government social services sector to better protect vulnerable children and to help ensure our children are safe with those that work with them. When children come in contact with people who have bad things in their head for the outcome of those children, we have the responsibility to stop those people, to protect our children, make sure that those children have a future, that we all come in here as members of Parliament to provide for the future of this country. We committed to halt the rise in children who are physically abused and reduce the current number by 5% by 2017 as part of our Better Public Services target. We are absolutely committed to this goal and determined to build a safer environment for all vulnerable children. And I'm very glad that members right across the House are in support of this bill. The government spends billions of dollars. I know that members have actually sort of talked about the issues of poverty and how it actually affects the outcome for children. And I echo the Minister of Justice. Poverty is no excuse for abuse of our children. So this government has actually spent a lot of money to try and better the outcome for people who are poor, so that we can actually assist them in providing better condition for their families. Over the past 4.5 years, 215,000 families have been able to access government grants to insulate their homes so that their children do not get sick. with rheumatic fever, so that their houses are not cold and they don't end up with colds and flus. We're on track to have finished insulating every state house that is capable of being insulated by the end of this year, sir, as well. We're also providing more places in early childhood education for children who need it most, and especially targeted funding to ensure that vulnerable children are enrolled at ECE. It is, in fact, those children who don't end up in early childhood education, and we want to make sure that they are in early childhood education. We have put money into that, and we're making sure of that. We've also improved immunization rates for children. Often people say poor people can't afford immunization. Well, we're providing it. Under national, 93% of 2-year-olds are fully immunized, and that is a great result to actually sort of boast about, I believe. Free visits to doctors at any time of the day or night, nearly all are all under 6s for them to actually visit doctors. Government has funded 149 extra social workers in low decile schools, and an additional 96 social workers have been added to the child, youth and family frontline service. We also know that effects of the global recession were hardest on those with the lowest income. So we took action to soften the sharpest edges of the recession, protecting working for families' payments and increasing them this year, legislating consumer price index increases to benefit levels, lowering income tax rates across the board, raising the minimum wage every year since we've actually been in government, and overseeing the slowest rate of increase to the cost of living in 12 years and increasing wage rates. Sir, there are a lot more that we can actually do, and that's why we have this legislation in the House today. We're working on a care strategy for children in state care, the Child Protect Line, Vulnerable Kids Information System, and increasing the pool of iwi caregivers. Anybody who works in government with children will be screened and vetted, and I welcome that. This will affect around 376,000 workers, and I'm sure that some of them will actually think that that is actually very cumbersome, and I'm sure some will even complain that they should not be vetted at all. Anyone with a serious conviction will be permanently restricted from working closely with children. We will introduce child harm prevention orders that can be placed on adults who pose a serious risk to children to prevent them from ever interacting with children. We're getting tough on people that abuse children, and where abusive parents go on to have further children, they will have to prove that they are fit parents. I know that that can be quite controversial in some sectors, but we must protect our children, because often those children in the past who had been hurt, abused, and even dead had been they've been abused and neglected and killed by those people who are closest to them, often their families, and we must do everything we can to protect our children. And I think this is a fantastic bill that the Minister has brought to the House, and I look forward to the Select Committee process, and I commend this bill to the House.